Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the show that's devoted towards your health, welfare, and well-being. Tonight's show is called Clinical Hypnosis, and I've been in practice in the Somerville area for 23 years. I have treated over 10,000 patients successfully using clinical hypnosis in my practice. I am a diplomat in clinical hypnotherapy by the American Board of Medical Hypnotherapy and the National Examiners of Hypnosis. Today's topic, if you watch this program, you may make some exciting changes in your life. And let's talk about that. What is hypnosis? Hypnosis is the study of the subconscious mind and its effect on our well-being. And this is a tool which we can incorporate and utilize in our lives to make changes where we're stuck and not transforming our lives into what we would like them to be. Now, the mind is like an iceberg. 10% on the surface is your conscious waking mind. 90% below the surface is subconscious, and this is the portion that we wish to address with hypnosis. Now, why use hypnosis? Hypnosis is there as a tool upon which we can cause change. Also, what you'll find is that the change occurring through hypnosis can be permanent change because the body always essentially wants to do the best thing for itself. Now, you can sit here today and we can talk about all of the reasons why we should change. Like, take something like smoking. I can sit here and talk to a patient give them 10, 15, 20 reasons why they should stop smoking. And you know what's going to happen? Nothing. Because there's a difference between understanding right from wrong and change. If not, we'd all be in a perfect world and we'd all be out on the jogging trail eating grape nuts all the time. But the fact is that we all have frailties, we all have weaknesses, and we all have things that we need to work on. And hypnosis is just the tool that allows us to undergo that transformation. Hypnosis is not like you are now, right? When you're watching me on TV right now, your mind and your body are physically very active. When you're sleeping, your mind is dreaming, but your body is at rest. Hypnosis is a point in which your mind and body are harmoniously at rest. But it's not just a matter of rest, however. It is a combination of relaxation and concentration simultaneously. It is a very, very specific state of mind. And it's very important that when we utilize that state of mind, that we are then, when you're in that state of mind, that unique state, your mind becomes open towards positive changes that are going to affect you and gets the conscious waking mind out of the way that frequently prevents us from making change in our lives. The body always wants to do the best thing for itself. We want to not overeat. We want to not smoke. It's self-preservation. We're animals. But because we've evolved into this higher thinking plane of thought, we've also allowed our intellect to justify all of our weaknesses, whether it's drinking, whether it's smoking, whether it's eating too much, whether it's not exercising, whether it's not any of the things that we know we shouldn't be doing for ourselves. So for those of you out there that maybe fit into some of that, clinical hypnosis may be a tool for you. And what we're going to do right now is that we're going to bring a patient onto the set today, and we're going to do some demonstration of clinical hypnosis in just a moment. What I'd like to do now is I'm going to do some demonstration of clinical hypnosis and some of the procedures that would be involved in a typical office visit if you were to go. Now, all hypnosis, as I said, is self-hypnosis, and a person's when they're in that state, there's not different types of hypnosis. They're either in hypnosis or they're not. However, what makes the individual go into a state of hypnosis varies from person to person. There's about 30 different types or techniques that I utilize in the office when a person comes in to find out what approach they need to bring them to this state. Clinical hypnosis is a lot different than something like going to the Marriott or going to the Elks Club to go in for group hypnosis. Although these techniques are utilized widely throughout the course of this country, group techniques are it doesn't feel so good when you are in large group sessions to the clinical hypnotherapist, because we pride ourselves in getting very good, high-quality results. Regretfully, when you have a large group and you're using a scripted program, you can only affect a small percentage of those people. Roughly, for something like smoking, maybe 1/3. For maybe something like weight reduction, possibly a little over 1/3. So these may sound like good results, but they're not really good results as opposed to what you could get one-on-one. But when you're doing large groups, you really can't tailor the session to the individual. So part of the process of tailoring that is to ask the appropriate degree of appropriate amount of questions when the person comes in, so that you could target the treatment. So they come in and they fill out a questionnaire in the office, kind of looks like this. Some sample questions that I might ask after the, besides the thing of different medications that may affect them, whether they drank 3 pots of coffee before they came in, which may affect their ability to go into hypnosis, but some of the things like this. Have you ever been hypnotized before? Well, if that person checked, yes, they've been hypnotized before, it's going to be a cakewalk for me, because as I said before, hypnosis is a previously conditioned event. If you've been there, you've been there. And if you've been there, I can take you there quickly. Also, each time a person gets hypnotized for the first 2 to 3 times, I can double the depth of the hypnosis. That's how come, although I can never guarantee anything in life, if I have enough opportunity, if I don't get it the first time, I know I can get it later, because of this doubling effect or deepening effect of hypnosis as you get to work with the person more frequently. Do you believe hypnosis can help your problems? Okay. Now, a question like that is not so important to me, because hypnosis is not a belief system. And I'll tell you why. Because many times I've had smokers come in where I've done a woman, and they said, well, is it okay if my boyfriend or my spouse sits outside the doorway or something like this? I said, that's fine. Whatever makes you feel comfortable. So I do the session. She stops smoking. And the boyfriend stopped smoking, who's had no indication or no desire to stop smoking. So it's got nothing to do with being a belief system. Have you ever walked or talked in your sleep? Because sleepwalking and sleep talking are subconscious events. You're not really consciously aware of it. So you're doing it while you're really not thinking about it. And these are all deal with this mechanism. Something that I feel has been done as a disservice to clinical hypnotherapists is, regretfully, this whole science has been in existence for about 150 years, although hypnosis has been going on as long as there has been animals, probably. But what's happened is that hypnosis has kind of gotten jumbled in with mysticism, or not occultism, but paranormal, extra-normal phenomenon. To tell you the truth, it really upsets me, because it's actually a very, very scientific practice. And when properly done, it's a strategic psychological tool to helping people change after they've been under many therapies and talk to a health practitioner ad infinitum. They understand their problem inside out, but you know what? They don't change anyway. Oh, I've been going to my therapist for 6 years. Well, are you better? Well, I understand my problem better, but they still have it. Well, this may be something a tool that you may use to make yourself better. Do you have a vivid imagination? If a person checks yes to a vivid imagination, what happens? That tells me that they think in pictures. So the technique in which I'm going to use is going to use imaging or pictures when I do the technique. Some people relax or are comfortable when they are told to relax. Relax, 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 relax. That would be another technique. Or we may try to call the mind to call attention to certain body parts. This is called progressive relaxation. The visual thing is called creative visualization. Or we may use strict command to cause a person to go into these relaxed state. So there's questions that I'm going to be asking all along these lines that give us information. Now, here's a very interesting question. Have you ever meditated? Now, people come in to see me, and they will say, well, I meditate a lot. Meditation is actually a different state of mind than the hypnotic frame of mind. Hypnosis is a unique characteristic. However, I like it when a person has spent time meditating because they've spent time going inwards, being reflective on the way that they think, just being reflected on being quiet. And that type of thing is a good thing because that tells me they've already done some preconditioning mentally. So I'm always hot on that when a person is like that. So after going through these techniques, what I'm going to do what I'm not going to do that's not so interesting is that there's a series of tests that we do that will give me the suggestibility level of that patient, because some people are easier and some people are harder. I always go in with the mindset that people are going to be really, really hard. So when they're easy, it's going to be easy. You take something like smoking. I've done a guy who did 5 packs of cigarettes a day. I thought that was going to be the hardest thing I'd ever get getting him off there. I stopped smoking after one visit, had no physical or physical or emotional withdrawals whatsoever from the smoking. You would think that you'd have to chain smoke all day long. They would certainly miss that. And they never look back at it. I've also seen people smoke 2 or 3 cigarettes a day, go through like the DTs from stopping smoking. So change is change. It often doesn't come in a nice, neat package as we would think that it normally would or should. So some of these tests involve a patient standing, potentially see whether I can get them to fall back or entrustulate themselves to me, or get them to relax and be able to hold or clasp their arms together. I used to spend a lot of time with this particular aspect of the science of hypnosis, but I found out as time goes on, it's just more important to overlay many different hypnotic techniques. And if you do that, you increase the likelihood of the results that you're looking for. So rather than wasting the patient's time and dime on just one particular technique, you just might as well lay it on heavy and lay it on thick and get on with the getting on. The average office visit takes approximately 1 hour. The person comes in, they fill these forms out. Usually they have some, when they first make the appointment, we give them some things to follow. You know, don't have 5 pots of coffee before you come in. Don't be taking any drugs. Don't be, if you're really, don't run behind with the appointment, and just come in a relaxed state of mind. So what they do is you come into the office, you fill these forms out, we do our consultation. Now keep in mind, I am not a psychiatrist. That is not the way in which I help people with these problems. I do it through functional, practical means, utilizing clinical hypnotherapy. So we do our consultation, and then we go into my, quote, do the hypnosis room. And in my do the hypnosis room, it's not like at the studio here where we're just using a lounge chair. I have my professional leather, my leather lazy boy in which we're going to stretch on out and feel good. So from there, they do that and they watch a pre-hypnotic video, and I've made numerous pre-hypnotic videos. This is not our session, but it prepares the person's mind for what needs to come next. Because some people, they're rushing in from their hectic day. They didn't find the office. They're upset. They're a little nervous because they're undergo hypnosis. So this film that they watch takes about 10 or 15 minutes, allows for them to just relax. And that's important because this is time that I would have to waste during the hypnosis session just to get them to that point if they just sat in the chair and relaxed there for a little bit. Also, the people that are very, very easily hypnotized, when I come into that room, frequently they're hypnotized when I first start. They're hypnotized right before I get going, and then I just pick up on it, and it's just like putting a big sinker in there, and I bring the person down to a really, really deep state. With us here today, and I'm pleased to announce, Ms. Tracy Alvarez, who lives in Southbound Brook, and her man is named Lionel, and her baby is named Jordan, and they live very happily, and she has acquiesced to being our hypnotic patient today. What we're going to do is we're going to go through some quick hypnotic techniques or approaches, and some of what you would expect. We don't have time to do the full session because obviously it takes an hour, but you will get a feel for some of the procedures involved from what I do here today. So what we're going to do is that we're going to attempt to alleviate Tracy's stress and cut down on any tension that she may have utilizing hypnosis. Now, when a person goes into hypnosis, can they stay in hypnosis? No. In fact, I did many studies over the years to see how long I can keep a person in hypnosis. And you know how long that is? Well, about a day. And that was with really, really conscious effort. You can pretty much bring a person out of hypnosis whenever you need to. The people, sometimes, to tell you the truth, people are having such a good state in that frame of mind because it's allowing them to get away from all of their pressures and all of the things that they have going on, that they prefer to be in the hypnotic state of mind. And usually in a case like that, I get up, I walk out of the room for half an hour, go on to my next thing, and I come back, and then I bring them out of hypnosis. And why? Because it's valuesome for them. They get a lot out of them. So the only physical contact that I'm going to make on Tracy or any other patient is that I take a pulse reading off of their wrist that gives me, I do Chinese medicine also. There's a particular type of pulse that we're looking for. And when I get that change in that pulse, I know that that person physically is in a decent state of hypnosis. There's also many other nuances that we're looking for. But let's start our technique of one way of approaching this as I would in my office. Tracy, what I'd like you to do at this time, I'd like for you to look me directly into the eyes. In a moment, I'm going to count from the number 1 to the number 10. By the time I reach the count of 10, your mind and your body will be in a more relaxed state than it is currently. 1, relax your mind. 2, relax your body. 3, 4, the tone and the sound of my voice are calming and soothing to you. 5, 6, 7, allow all conscious thought to fade from your mind. 8, 9, 10. Close your eyes at this time. I'll request that you do not open your eyes until I ask you to do so at the end of our session here today. If at any time during the course of our session here today, your body needs to move, to adjust itself, to allow yourself to be more comfortable, you will find that you will be able to do so without any break in your relaxation in the least. If at any time during the course of our session here today, your body needs to move, you will be able to do so without any break in our relaxation in the least. You will listen to me and listen to my voice alone. Listen to me and allow your thoughts to fill with what I say. Your body has brought you here today to accomplish 2 very important and vital health reactions. Number 1 is the elimination of unwanted stress and tension from your life. Secondarily is the elimination of the accumulated amount of stress, pressure, tension, and tightness which may have been a portion of your life for a very, very long time. With every breath that you take and with every beat of your heart, your mind and your body is programming for change and relaxation more and more and more. The tone and the sound of my voice are very, very calming and very, very soothing to you, allowing for you to feel one with the chair, extremely relaxed and very, very tranquil. In a moment, I'm going to count from the number 3 down to the number 1. With every number that I count, I would like for you to take in a deep breath. And each time I say the word relax, I would like for you to relax and allow the breath to rush from your body. 3, taking in a deep breath and relax. Releasing and relaxing more and more and more. Good. 2, deep breath in and relax. Releasing and relaxing more and more and more. Good. And 1, deep breath in and relax. Releasing and relaxing more and more and more. Good. You may continue to breathe normally at this time, and as you continue to breathe normally, your mind and your body will release and relax more and more and more. In a moment, I'm going to count from the number 3 down to the number 1 again. With every number that I count, I would like for you to mentally release each of the muscle groups that I call to your attention. 3, release all of the muscles in your head, neck, and shoulders. See them relax, feel them relax, and allow them to let go in your mind at this time. 2, release all of the muscles into your arms and into your back on both the left and the right-hand side. And 1, release all of the muscles across your chest, your stomach, and into your legs, and feel the relaxation flow down your body and down through your feet. Like a series of dominoes all of the muscles in your body, beginning at the top of your head, they flow one into another as each one releases and relaxes. Now I would like for you to imagine a white light coming down from the sky and penetrating into your abdominal area. This is a white healing light of transition. This is a white healing light of change. This is a white healing light of stress reduction, affecting every fiber, every pore, and every nerve cell of your body. Now I would like for you to send a signal from your mind down your body to your feet. I would like for you to make a mental picture of your feet and your mind at this time. Imagine all of the muscles in your feet relaxing around the arch of your foot, around the ball of your foot, around your heels, around your toes. Some people feel a numbness in the feet as they allow them to relax. Some people feel a tingling in the feet as they allow them to relax. Everyone, however, experiences a natural heaviness in the feet as they allow them to relax. The feet become heavier and heavier and heavier. Lead-like in nature, extremely difficult to move as your mind and as your body programs for change and relaxation more and more and more, sending a signal from your mind down your body to the muscles in your thighs, knees, calves, into your pelvic area. Everything releases and relaxes. Everything lets go. Very, very calm, very, very peaceful, very, very tranquil, and extremely relaxed. And now sending a signal from your mind out to the rest of the musculature of your body. Any of the remaining tension, pressure, tightness, or constricted areas that you may feel causes and allows you to release and relax at this time. Like a series of dominoes, all of the muscles in your body, beginning at the top of your head, they all flow now one into another as each one releases and relaxes. Now I would like for you to imagine a large spiral or a whirlpool in the front portion of your mind. A spiral or a whirlpool goes around and around, downward and downward, deeper and deeper, around and around, as your mind and as your body programs for change and relaxation more and more and more. Around and around, downward and downward, deeper and deeper, calmer and calmer. Your mind is relaxed, your body is relaxed, and you go into a more comfortable state of mind and body well-being. Now I would like for you to imagine a wave, like an ocean wave, rushing up over your body, rushing back down again, draining and taking from you all of the tensions, all of the tightnesses, and all of the pressures from your mind and from your body, causing and allowing you to release and relax more and more and more. Rushing up over your body, rushing back down again, draining, taking from you all of the tension, all of the tightness, all of the pressures, causing you to relax, allowing you to relax. Relax and going deeper, deeper and going deeper and deeper and deeper. Now I would like for you to imagine a well-lit flight of stairs, 10 steps and all leading to a large double door. A well-lit flight of stairs, 10 steps and all leading to a large double door. In a moment, I'm going to count from the number 1 to the number 10. By the time I reach the count of 10, the doors will open and you will cross over the threshold into the most beautiful place you could ever possibly imagine, the most beautiful place in your mind, and you will hold that image in your mind at this time. 1, taking the first step. 2, taking the second step. 3, 4, taking the fourth step. 5, 6, 7, taking the seventh step. 8, 9, 10. The doors open and you cross over the threshold into the most beautiful place you could ever possibly imagine, the most beautiful place in your mind, and you will hold that image in your mind at this time. Excellent. As you hold the image of the most beautiful place in your mind, you will notice whether you are indoors or out. You will notice whether you are indoors or out. If you are outdoors, you will notice whether the sky is clear or cloudy. If you are outdoors, you'll notice whether the sky is clear or cloudy. You will notice whether there are living creatures nearby. You will notice whether there are living creatures nearby. You will notice what you would hear in the most beautiful place in your mind, or whether you would hear music. You will notice what you would smell in the most beautiful place in your mind, what fragrances you would perceive in the most beautiful place in your mind. You will see it. You will smell it. You will touch it using all of your senses. Excellent. You are learning to use a highly specialized portion of your brain, and through guided imagery you interact directly with your body. You open the lines of communication between your mind and your body more and more and more. Now I would like for you to imagine a well-lit flight of stairs, 5 steps in all. In a moment, I'm going to have you mentally ascend each and every one of those 5 steps. With every step that you take mentally, your mind and your body will become either 10 or 100 times more relaxed than it is currently. 1, taking the first step, and your mind and your body are either 10 or 100 times more relaxed than it is currently. 2, taking the second step. 3, taking the third step. 4, and 5. Relax your mind. Relax your body. Relax, 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 relax. You will listen to me and listen to my voice alone. Listen to me and allow your thoughts to fill with what I say. All other sounds which you may hear, they will have only a calming and soothing effect on your mind and on your body. I would like for you to imagine, use your imagination for a moment. I would like for you to imagine warm, golden sunlight filtering deep down within your body into every fiber, every pore, and every nerve cell of your body. The gentle, penetrating warmth flows over, through, and around your muscles, allowing them to relax and uncoil. Warm ocean waves bathing you in a sea of warming, soothing, rushing up over your body, causing and allowing you to relax. With every breath that you take and with every beat of your heart, past tension, tightness, even emotional constriction that may have been with you for a long time is allowed to wash from your system now, allowing the barriers towards change to leave like a distant, distant memory. Allowing the relaxed state that you are now feeling to weave a tapestry of total stress-free consciousness into the vision that you see. Now, I would like for you to imagine in your mind what used to cause you tension, stress, or pressure. You will make a mental image of this in your mind, whether it be anxieties, your day in and day out work, your work environment, home pressures, traffic. But as you see this vision, as you create this sensation, allow the vision of total relaxation to continue to soothe your thoughts, your mind, and your body. Allowing the relaxed state that you are now feeling to cause you to wash this away. The relaxation response is a part of you and will remain a part of you as long as it is useful to you. With every breath that you take and with every beat of your heart, these suggestions are growing stronger and stronger and are becoming part of your new habits for health. These suggestions will stay with you as long as they are useful to you. With every breath that you take and with every beat of your heart. In a moment, I'm going to count from the number 1 to the number 5. By the time I reach the count of 5, you'll be fully awake, fully aware. 1, 2, 3. Relaxation response firmly emplaced in your mind. 4, you feel some of the energy coming back to the musculature of your body. And 5, you may move your body if you wish to do so at this time. You may open your eyes if you wish to do so currently, becoming more and more awake, more and more aware. Hi, Tracy. How did that feel?
Strange.
Well, a strange sensation, like deeply relaxed, but yet within feeling what was going on as far as your surroundings.
Heavy and relaxed feeling.
Those are very common sensations. A person feels like, but it's almost like you're under anesthesia in a way where you can't move, but it's that twilight thing where you kind of know what's going on around you. That's normal with clinical hypnosis. And although we didn't do a complete session today, I thought that going over some of the procedures would be of value to you. And I would like to thank you, the viewing public, for watching. And we'll see you, and thank you, Tracy, for coming and joining me today on Natural Healthcare Alternatives. I'm Dr. James Golding. Until next time.